Bronchodilators relax airways, smooth muscle, and relieve bronchospasms. In early cyanosis, the nail beds turn blue. Cyanosis. A hemothorax is a collection of blood in the space between the chest wall and the lung. Hemothorax. Periodic breathing occurs mainly at night and is characterized by hyperpnea, followed by apnea. Hyperpnea. The nurse swabbed the nasopharyngeal area. Nasopharyngeal. In the 1920s, people had to get vaccinated for pertussis. Many people have excess phlegm while they're sick. Phlegm. Kayla had rhinoplasty surgery done a couple weeks ago. Rhinoplasty. Overexposure to silicone in factories can lead to silicosis. For nursing school, all students must get a tuberculosis vaccine. Tuberculosis. Angie had to have bariatric surgery. One of the patients had a colostomy bag. Angie had to have surgery on her duodenal ulcer. Linda was referred to the gastroenterology department. Brenda was diagnosed with an inguinal hernia. Jacob had to have his yearly proctology exam. The nurse took my blood so they could test the serum bilirubin. Amanda was diagnosed with enteritis. A patient called the dentist complaining of a dentalgia. After I had my wisdom teeth taken out, I had hyperemius. My grandma had to have a cystography done. Tammy had to have a cystopexy done last week. The patient in room 212 was diagnosed with a glomerular nephritis. Scott had gallstones, so he had to have a lithotripsy done. My cousin was referred to nephrology department for her kidneys. Nephrology. Polyuria is a sign of diabetes. Polyuria. Michaela had to have a ureteral stent put in to increase urine production. Ureteral. A urinometer measures the produced urine. A urinometer. Olivia had to be referred to urology because she had excess UTIs. Urology. Some patients have anuria after surgery. Anuria.